In my healthcare system, we weren't perfect, but we had a sense of community. We had much better ratios. We were treating our patients like they were a part of our community, and we were treating our team like they were a part of our community. The new healthcare system has lower employee engagement. They have lower quality. They have lower patient safety. And so leadership truly matters on these topics. I'll tell you where I have some hope.
Welcome to season 2 of our podcast, Meaningful Marketing, Mentoring, Mattering, with me, Joseph Alcantara. This season, we'll hear from inspiring experts who are continuously thriving while making meaningful breakthroughs in their careers, advocacies, and personal lives. Before we dive in, please don't forget to hit the subscribe button and notification bell so you're always updated every time we have a new podcast or video episode. Today, we are very thrilled to have Geoffrey Roche, the Heart Leader, join us. Geoffrey inspires and equips leaders in education and healthcare to tackle pressing issues through empathy and strategic innovation. Let's dive into his transformative journey and explore how leading with heart can pave the way for sustainable success. Please welcome to the pod, Geoffrey.
Thank you.
There. Hi, Geoffrey. How are you?
Joseph. Thanks for having me.
Well, thank you so much for saying yes to this opportunity to speak to you. Looking at your profile, the combination of leadership with empathy, with a heart, as well as you being in, I would have to say, relatively cold and functional industry is quite an interesting combination. That's why when I saw your profile, this is really very interesting. But I want to hear it directly from you. Can you take us back, give us your meaningful life story, your origin story, your background, and your life experience that led you to where you are today?
Yeah, absolutely. So certainly by background, I am a first generation college student. My mother actually was born in Germany, and my family came to the United States in 1963 by boat. Really with my grandparents' desire to raise their children, my mother and my uncle, in a country that stood more for democratic principles. And so, obviously, as you can imagine, my grandparents grew up in Germany at a time of great crisis, and also, unfortunately, the time where we saw our world probably experience some of the worst times in history. And so, their dream was to bring their children and raise them in a much different country than Germany was. And, that piece has kind of stuck with me without question as I was raised around a lot of the work I do today, certainly around, diversity, equity, inclusion, and belonging and all those types of things. But then, my parents actually divorced when I was 5, and I was raised predominantly by my mother. And my mother was actually a single mom in many cases, but also was graduated with her nursing degree at the age of 5. Or I should say, I was the age of 5 when she graduated her nursing degree. And I remember her going to school and dropping my brother and I off at daycare so that she could get that education and then ultimately become a nurse. Certainly, her influence had a huge impact on ultimately what led me to start my career in hospital administration. Certainly wasn't going to be clinical, but had the privilege and opportunity to do that. Worked in hospital administration for just under a decade. Doing all aspects of community and external relations and such, and really continuing to grow in all the work that I've done throughout my career. But after that, actually spent some time in academia on the academic leadership side, serving 2 presidents on their cabinet, and then also moved and did some consulting related work in the higher ed and ed tech space, and then ultimately was recruited to Siemens Healthineers to lead North America workforce development. And so I always tell people I've been, on the hospital side, the higher ed side, and now certainly on the more corporate side. And but more importantly, the piece that's important within that journey is when I was in my hospital system, it was where I had a leader who was our CEO, who was also a nurse, who really mentored, coached me, and empowered me to become the leader that I am today. And it was really her that showed me the way and really helped me to understand really what was it like to connect at the heart as a leader, and how can you not just transform but impact lives when you do it that way. And so that piece was very transformational.
And I love the combination of your mom being a nurse and your CEO also a nurse that heavily influenced you in your life, as you've said it, that probably have trained you to who you are today, especially when it comes to applying your leadership principles and having that at your back pocket in terms of how you are doing things, the principles that you uphold, and you being dubbed as the heart leader. For folks who are listening to us today, who probably would be their first time to hear the term, what do you mean by heart leader? Can you share with us what that title means and how that shapes your leadership style and how you apply that every day?
Yeah, absolutely. I mean, really, when you think of the idea of a heart leader, there's many ways to look at it. One of which is the fact that all of us have a heart, and it may that heart may beat different beats per minute, but ultimately, what all of us seek, especially in the workplace, is connection. And, generally, even in scientific terms, we know when people have connection, their heart is actually stronger. Clinically, that's well documented. And so, when you think about it in the workplace and you think about it from a leadership perspective, I often describe it that irregardless of title, any and every leader has an opportunity to make it or break it for somebody. And, if you think about it clinically, there's a term called broken heart syndrome. And that often happens when somebody loses a loved one, their partner, their spouse. But if you think about it in the workplace, when you face trauma, that impacts your heart. And so all aspects of who we are impacted when we serve with a leader or under a leader who doesn't treat us with respect or doesn't treat us with kindness or compassion. And so it really gets at the core of those types of things. It's really this genuine, meaningful connection that somebody is going to seek. I'll also say that when you hear the term heart leader, in fact, in this space, people will say, "Oh, that just means you're the nice person. That doesn't mean you're going to hold people accountable." It has nothing to do with that. You also have to be accountable. But when you're a heart leader, you recognize that you're going to choose compassion and empathy in the way that you communicate about that accountability. You recognize that you're going to choose the desire to lift somebody up instead of tearing someone down when there's an opportunity for growing and learning. And so it's really that innate connection that stands above everything. And again, I learned this from my first CEO. I saw her in action. I saw how she went about it. It's also, I would say, incredibly focused on that idea of mentorship and like a coach, and really that perspective that when we hear of leadership philosophies, if you can coach somebody, if you can be committed to walking alongside them in their journey to help them achieve their dreams, everybody benefits from that approach. And so that's often how I talk about it.
That is a great explanation and definition of what heart leadership is. Because, yes, it's very true. At this day and age, there are a lot of different leadership principles that we hear and experience in our corporate and professional lives. When you explained that, and by the way, it's actually my first time to hear about, because I don't have a medical background, the broken heart syndrome. I just suddenly remembered this podcast that I've heard when they've interviewed the co-CEO or co-founder of Netflix, which
Mm,
was pretty controversial because he was saying that I built a company and the company was successful because we are not family, we
mm,
are a team. Um, if you're a family, you have this level of unconditional love for each other.
yep,
It's like almost cuddling like your children to be with you, and you're also very forgiving, you're very
yep,
apologetic, you're just going to give them a lot of space to to do what they need to do, but at the end of the day, we're family, so whatever happens, you'll be there for each other. The flip side, though, is that at Netflix, they're saying that no, we are a team. We help each other to grow, but they're relatively, less, forgiving, if I can put it that way, because they're very much performance driven.
Yep.
Everything is based off of KPIs, business growth opportunities, really allowing people to shine. And for those people who are underperformers, I'm sorry, but you have to say goodbye to them. Embracing heart leadership and understanding what empathy and compassion and coaching is based on your experience. What's your stance? Or is there a world where you can mesh both at this day and age? Or there's really one single kind of leadership principle that should stand, as opposed to simply looking at people as head count or numbers to be able to deliver to a business goal?
Yeah. Well, I mean, first say that I think to your example of Netflix, I agree with the philosophy. In fact, in every workplace I serve in, when I hear a leader say we're a family, I generally in my mind think, how disingenuous are you really being? The reality of it is that what people seek in the workplace is community. They're not seeking family; they're seeking community. They're seeking a sense of belonging. They're seeking a sense of respect and appreciation. And so I think leaders have to really think about that, particularly because, to your point and to that conversation, I've never been in a workplace that felt like family. It's just a very different, sense of feeling. I do think, though, look, I mean, we're at a time globally where when you look at the research and you look at the evidence, it's very clear that we sit at a time of great challenge, particularly on the issue of leadership and certainly on the issue of the workplace. And when you really boil it down, what it shows is that we haven't focused enough on people. We haven't focused enough on truly, authentically creating that sense of belonging, where everyone feels in the workplace they can be who they are without fear of any retribution or fear of any negative impact to them. And so what happens today is people hide who they are. There's a lot of that occurring. And when you think about that idea of hiding who you are, you're probably not going to be able to perform at a higher level. You may do your very best, but you're probably not able to be there and do that. And so I think that leaders need to be smart on this topic. If you really want to have a high performing culture, then you have to invest in your people, and you have to create that sense of a culture where people feel a sense of belonging. They feel valued, appreciated, respected. And then ultimately, you're going to have the highest potential impact or the highest revenue, because you're going to have a magnetic culture where people are just going to want to get into that workplace every day because they know they're going to be appreciated, respected, valued, and understood. So, healthcare is an interesting space when you look at this, because when you look at culture and you look at engagement, you can see in many, many examples across these years, research showing that when we have better culture, when we have better engagement, we have higher employee engagement scores, we have better patient engagement scores. And the same thing goes with quality and patient safety. Time and time again, it's the absolute truth in healthcare. And it's no shock, because ultimately, if you're a nurse or you're an allied health professional, you're a doctor, you're a team member in a healthcare environment, if you feel heard, listened to, appreciated, respected, valued, you're going to work your hardest each and every day. And that's not to say anybody in healthcare isn't today. They are. But when you're in a culture that's causing burnout or a culture that's causing moral injury, at some point, you can't be well enough to take care of another person. But ultimately, it's the employer's responsibility to create the culture that takes care of you so that you can be in a position to take care of your patients. And so, do I believe it's possible? Absolutely. And there are some organizations, not as many, that are certainly contributing to this as we speak across the globe. And I think we absolutely, in the United States, have to acknowledge that other parts of the world have other social aspects that also take care of people better than we do. But we've got to focus on these aspects if we really want to be a high-performing organization.
Oh, that's great. And I love the optimism, and I believe in that optimism as well. Not only in the healthcare industry, but across different industries, that this kind of mindset and thinking is actually possible if we will just try to implement that. But going into the healthcare industry, because it's pretty close to my heart as well, because my husband is a nurse,
Hmm.
is an ED nurse. And I do understand sometimes that, you know, at the peak of the craziness in that department, and the bed capacity, the triaging that is happening, the ratio between the nurses and the aide, and how crazy ED can be, right? And I do understand that, as administrators or leaders within a hospital setting, for instance, you will all try your very best to make sure that all the staff are, heard, seen, appreciated while being themselves, but at the same time, making sure that they follow their protocols, they do the procedures correctly, as well as that being translated to all the patients that they support and serve. You've mentioned earlier that there is a world where it's possible to blend that reality despite the imperfection that we are really experiencing in this world, especially in this industry we're in. When it comes to the nurse patient ratio, there are really challenges in different hospitals. In your view, how is this ideal world looking like if you were to describe it? And how far are we, specifically in the US, for example, in achieving that based on your view?
It's a very interesting topic. And I'll tell you, I was just at a very large academic healthcare system earlier this week, and I was talking with an executive there that particularly about my observation on this very issue. And one of the things I shared with her was that I'm concerned that as our larger healthcare systems have become, we have gotten farther removed from both serving the community as well as recognizing that ultimately we're an anchor institution. And the idea of an anchor institution is that we're there for the community, for the patients, for the team. Yes, we're an employer, but so many of our employees come from that community that we serve. And therefore, utmost importance is all about service. As our healthcare systems have grown to become larger, it's my fear that we've lost that important connection. In many ways, we've lost that identity. And I was asking her, because she has been at several large healthcare systems, if my observation was accurate, and she said to me, absolutely, positively. And so this is where in healthcare, leaders need to own it, and also boards need to own it. The governance process of a healthcare system needs to remember that their responsibility is fiduciary. And what fiduciary really means is they have ultimate responsibility for the success and sustainability of that healthcare system. That does not just mean financial success and sustainability, but that means every aspect of sustainability: quality, patient safety, finances, strategic. But also, there's nothing that can be done without the people. And so it includes the workforce. It includes important matters that ultimately help to have a high performing team. And so boards need to own it. They need to hold the executive team accountable to really set the stage for a people first culture. When I served in my healthcare system, and I've done other work with other larger healthcare systems, I will tell you that in my healthcare system, we weren't perfect, but we had a sense of community. We had much better ratios. We were treating our patients like they were, a part of our community, and we were treating our team like they were a part of our community. We knew each and every day that we needed to continue to move an inch and a foot towards excellence. Every day was another day to be better and to do better. And people were at the cornerstone of that. But we had an executive leader who cared about that. We had a board for most of the time that cared about that, until they led a process of being acquired by a larger healthcare system. And then a lot of that work has gone out the window. And frankly, all the data that we had at the time, we had high engagement, employee engagement, had higher inpatient engagement, higher quality. The new healthcare system has lower employee engagement. They have lower quality. They have lower patient safety. And so leadership truly matters on these topics. I'll tell you where I have some hope, though. I do believe that as the younger generations start to move into leadership, I do see a different way of leading. I see a leading type of idea that's more inclusive. I see leaders in the younger generations that care about diversity, equity, inclusion, and belonging. And I also see a different type of leader among younger generations that also understand that, yes, work is important, but we also have to take care of our mind, body, spirit too. And that if we're not in the best health personally, how can we do the best for another person? And so I'm encouraged by that vantage point. And it's my hope that while we have this continued work occurring, that there are other leaders who are going to continue to support them, because they're going to have to be prepared to step into these leadership roles. And I'm hopeful, but at the same time, I'm a little worried because the culture today makes it hard for them to even want to be a leader, because they see the damaging toxicity that exists. And so, but that's what does give me hope.
I especially love what you've mentioned when it comes to creating a sustainable, future ready workforce that is very much people focused, which again, all goes back to heart leadership, right? Um, and I know that, the executive team, the leadership team would definitely create a document, a mantra that they will roll out to everyone, to your point about not really being a big fan of song and dance, because it's the reality of creating those DEIB departments right now. We're creating this for you. There are amazing programs and a landing page on the company website about it. But what actually happens and translates on the ground
Yep.
for those, for example, for the healthcare industries, for those tired and challenged nurses on the floor, or for, say, for example, a typical corporate setting, the rank and file staff who starts the day there on the ground. Based on your experience and based on what you've seen, if we are to apply these groundbreaking principles, while simple but groundbreaking principles of heart leadership, which is all grounded on empathy and compassion, are there groundbreaking solutions or cases that you've seen that resulted to innovation, that resulted to real growth and a deeper sense of community, that not a landing page on a website defining DEIB is all about, have really resulted to something amazing?
From a workforce perspective or culture?
It can be both. Let's do both.
Yeah. I think so I recently had the opportunity to travel to the University of Wisconsin Health. And, I'll tell you from a workforce sustainability perspective, what they have done with their career pathways and allied health programs on the health system side is truly amazing. They have focused on building youth apprenticeships and career exploration opportunities that have impacted hundreds upon hundreds of youth in their region, that ultimately now are serving in their healthcare system as nursing apprentices and MA apprentices that ultimately are going to continue to grow in healthcare. But they've also benchmarked it, and that's really, really important too, is they are now paying attention to the fact that they're going to diversify their workforce. They're bringing in, youth from different parts of the state that have would never have had that opportunity for it to not have been these types of programs. And so they're having a diversity, equity, inclusion, and belonging sense right from the start, which is really, really important. And they're also addressing sometimes the burdens or challenges that would impact that community. Making sure that they have access to transportation to actually get there, making sure they have access to other support so that they can be successful. That's the type of stuff that's really, really important, because if we're going to really have a workforce that can reflect the patients that we serve in healthcare, we have to be innovative and thoughtful about the approach. You have to really get deep into the community. You really have to, create programs that can impact all and really get to an equitable solution. So that's certainly an example that gives me great hope when I see that. And the team there has done a phenomenal job of really thinking about this from both a sustainability factor, but also thinking about it from how do you build that future workforce perspective. From a culture perspective, I think that there's definitely different examples that are definitely important and unique, in their own ways. I'll say, I can't think of a specific hospital example that comes to mind, to me right away, where I think, wow, like, just that experience, was second to none. And a lot of that, I think, is because, we have just in the healthcare space been so challenged on this. I think there's definitely examples where I've seen departments and different units having very special aspects about it. But I can't think of one, particularly that just comes to mind, right off the bat. I will say that if you look at the healthcare industry, it's been interesting, right? Because over time, we've kind of tried a lot of different things when it comes to these issues. We've tried Studer, we've tried follow the Disney model. We've tried so many different ways to have true like service excellence, concierge, customer service. But ultimately, what it does come down to is how we just treat one another, how we treat those that we work with, how we treat those that we serve. And I think there are great examples from other industries on that. You think of Disney. When you go to Disney, most people, other than long lines at times, most people are not going to suggest or further share that they've had a bad customer service experience.
Mm.
That's not usually what you hear from people. I know the countless times I've been there, I have not had a poor customer service experience. Um, and, pretty consistently, they have, at least based on what feedback I've seen, they have pretty strong staff engagement, as well. And so I think, those pieces are definitely, very, very important. The same could be said in, certainly other industries as well. I think the key differentiator there is, if you look at Walt Disney, one of the things that Walt Disney always believed in was that we should always be thinking about making a magical experience for every, in his eyes, every child. But when you articulate that further, he really was saying everybody. And so, that's the type of thing that I think every industry wants to have. Regardless of the work that we do, we all absolutely, positively want a magical experience wherever we serve and wherever we work. What that magical experience looks like could be different depending on the industry, but we certainly want to be in a place where we can survive, but first and foremost, but really where we can thrive. And that's really what has to be always thought about, within this. And that's community. When we have community, we have so much opportunity to thrive. So that's what comes to mind, kind of to your question.
Love those examples, Jeffrey, because it's very tangible and it's very relatable for most people who are listening to our conversation, which grounds and anchors the concepts of what heart leadership, what compassion, empathy, and DEIB is all about in today's generation that we can carry over in the coming years. Which, in my view, right now, because those principles that you've shared, those really very meaty and meaningful ideas, which hopefully can be transitioned and be continued over the years, would be passed along across different industries. I know that you're doing your part to be able to share that with others. And that is the reason why, even in my podcast, mentoring is a very important anchor, a very important advocacy that we are aspiring to move forward with. Knowing that this kind of leadership principle and DIB in general has to be applicable across all different fields and industries, regardless of where you are in your life. How do we ensure, as people who are advocating for DIB and this kind of leadership, make sure that we mentor the next generation or coach them and train them so that we can pass this important, factor along, so that when they eventually create their companies or become entrepreneurs or become the next CEOs in the coming generations, that they will still embrace, live, and practice this.
I think to your point, ultimately, the concept of mentorship is not only absolutely essential in every organization, it is a difference maker for those of us that have had the experience of having a mentor or multiple. When I was a college student, I had the privilege of meeting Chris Gardner, who was the subject of The Pursuit of Happiness. And for those that have seen the movie or for those that have read the book, one of the things that Chris Gardner will talk about often is the power of mentorship. And when Chris Gardner was on campus, I was part of a student government dinner with him, and I will never forget the one thing he did in that room, which was he asked in front of every executive at our college, he asked every student in the room if we had a mentor. And most of the students did not at that time. I did, and my mentor at the time was actually in the room. And so when I raised my hand and said that I did, and he said, "Well, do you know who your mentor is?" And I said, "Well, he's actually in the room." He then looked at my mentor and said, "You are the only leader in this college that's doing it right. To the rest of you, you better figure out how to help the rest of these students, because that's what higher education is all about." So, I think mentorship has to have a systematic approach. And, the key here is that you can't just take somebody and put them on someone as if they're a mentor. There's got to be an innate connection. There has to be a desire to walk alongside, a desire to coach, a desire to empower, but also a desire to challenge. Because some of my best mentors have also been people that have challenged me in a really dynamic way. There's also the important concept that a good friend of mine who's actually wrote a book called Pathfinders, he does work around the idea of he runs a startup called Latitude. And in his book, he actually argues that instead of the idea of just a mentor, we should actually have a personal board of advisors. An idea that we've got a group of people who represent, maybe our industry, but also a diverse group that's going to challenge us, coach us, be the group that we go to when we're seeking opportunities, but also be the group that we go to when we're wrestling with something. And I think that that's really, really important as well. I look at it from the vantage point of, when President Obama was president, he rolled out, My Brother's Keeper and My Sister's Keeper, very effective programs. And at the heart of what President Obama was doing there was this idea of we have a community to support us, to help us to grow, to lift us up when we may not have the opportunities to be impactful and successful ourselves because of systemic racism, because of just different challenges in our society. But ultimately, it comes down to community. And so I know, as someone who has benefited immensely from mentorship, coaching, etc., that I have always made it a personal priority to do that, for others and to others, whether in the workplace, whether in the community that I live, whether in different organizations that I'm involved in. And I think leaders have an ultimate responsibility to really do that. In fact, when I see leaders who aren't, to me, they're failing one of the most important parts of leadership, because I'm certain that they had somebody who helped them get to where they are. And so giving back is the ultimate sacrifice that any leader should make. And so I think you're right. It should absolutely be a fabric of every aspect of an organization. It should certainly be measured. It should certainly be a part of performance management, and certainly should be something that everyone has an opportunity to have a mentor, whether in the organization or outside. There should still be a way of helping them to have a mentor.
Well, first, thank you for sharing your Chris Gardner story. We have a commonality. Well, first, when I watched the movie The Pursuit of Happiness, that movie changed my life. And I didn't realize, I had never in my wildest dream imagined meeting the real Chris Gardner, which I also did in 2018. It was a literature festival, and he was one of the keynote speakers, and he promoted his book. I'll be honest, at first, I saw the movie first, and then during that event, he handed the book, and it really, really changed my life all the more. And for me, that's the type of an indirect mentor, because I learned a lot from his life story as well. And meeting him in person really made me realize and humanized what I just saw from a distance, right? Which goes back to, what you've mentioned about mentorship. And I fully agree that people today should really leverage that wherever they are in their journey, whether they're, a younger person who's starting their careers, or even if you're a more seasoned veteran who would either want to be mentored by someone or participate in reverse mentorship, or someone who would want to mentor others, right? So my question here is that for those people who may not have the opportunity to be in a company that would have a structured approach to mentorship, or for those people who wouldn't know exactly where to begin, because I'm sure that people are here like, oh, look up people from LinkedIn and then try to do a cold outreach. Where can people begin when it comes to their mentorship journey, whether you're a mentor or a mentee?
So I think it all depends, right? I mean, there's definitely some level of, opportunities within one's college, whether you're, for example, even going back to wherever you did your undergrad, there could be alumni who, could also be mentors, specifically. Certainly there's also great starting points in an organization. For example, I believe every organization should be doing a personal development plan. That was an experience that my healthcare system did, and it was it was really really important because it also covered things like mentorship, and I worked for leaders there who always were looking to get me access to a mentor. It was regular part of our organization. So I think for organizations that are not doing that, that's a great avenue, because simply asking the question of an employee, do you have a mentor, could be, to your point, a life-changing moment. Connecting them to somebody, introducing them to somebody, that's the responsibility of a leader. I'll give you an example. I once had a team member who shared with me that her desire and dream was to become a nurse. There was no way that I could really mentor her in that dream, but I knew I could connect her to somebody else who could mentor her. And so I did, and ultimately it led her to go to nursing school, graduate, with her nursing degree, and become a nurse and achieve the dream that started when she had, I had the privilege of working with her, and we had the chance to work together. But ultimately, I think this is where organizations need to take ownership, because it's not easy for everyone to understand how you go about getting access to a mentor, particularly if you come from different backgrounds, or coming from different communities where maybe you just haven't had the same level of access. And that's why I think, particularly in the workforce development space, we talk a lot about that whatever program you do, mentorship has to be a part of it. And so when I was sharing that example of UW Health in Madison, Wisconsin, for example, they've built mentorship into all of those career pathways, so that whether they're a high school student, whether they're a college student, they're getting an assigned mentor. And when I say assigned, they're getting somebody who's in that area that they have identified as an interest to them, so that they have somebody they can go to. And that person is not always the direct supervisor. It could be someone else, but they're getting somebody who the team has validated as somebody who could actually be a good encourager, a good supporter, those types of things. They're also trying to identify somebody who could be their mentor that best relates to them, and vice versa. Those things are powerful. And so when I was there earlier this week, I got to meet many of those students. And the one thing that they shared that was prevalent throughout all the conversation was, yes, the experience was wonderful, but it was actually the mentorship that they've received from individuals in that role that has now made them realize they want to go on and be in that role. And so, particularly with young people, that's what they need and want. And so we need to, leadership wise, create that, because it will make all the difference in their lives.
That is a great practical list of potential tips and tricks that hopefully folks will be able to embrace, because there's a lot in there. And if people will be able to unlock that opportunity, it will work wonders. I mean, because it's not only helping you today, but it will also help you in the future. I love how you touch upon younger folks. And as we draw closer to the end of this conversation, Jeffrey, I was like thinking, if you were to reflect on your journey from your childhood to where you are today, because we began there, right? Your interests, and then what led you to doing what you're doing today, and how you're trying to somehow find a way to create a positive dent For those people that you are directly or indirectly touching through the things that you are working on, working through, and advocating for, if you're going to talk to that younger Geoffrey who's just about to start that journey in terms of where he can be today, what would you tell him, which I think will also be very, very beneficial to the younger folks who are listening to us today?
Yeah, I would absolutely have told younger Geoffrey to really chase those dreams and really not focus so much on being difficult with myself at times, challenging myself, but rather being more willing than ever to try new things and really innovate towards those dreams. I think, far often when you get these types of reflective questions, I look back and I think, there were many times where when I look back on my life and my journey, I've told some youth this recently. I failed several classes, um, most of them math classes. And I had guidance counselors who would tell me, you're not going to get to go to college because of this, or you're not going to make it to this because of this. And so the reality of it is it never stopped me. And now I'm in my doctoral class and in a doctoral program. And the sheer fact is, I would have also told young Geoffrey that the most important thing you can do in your career is to have a community of not just supporters, but also people who are going to encourage you, challenge you to do better and be better. Because when you have that, literally, you're unstoppable in the work that you do and the passion. And then the final thing I would say is always be purpose driven. Always, whatever it is that you're passionate about, connect that to your purpose, and don't let anybody or anything get in the way of your purpose and your dream to achieve and aspire to that. Because the reality of it is that if you're purpose driven and it connects to your heart, you are absolutely going to remain committed to achieving it. And so I think that's what some of the things I would share with myself.
And I'm sure that the younger Geoffrey will be so proud to see how he eventually turned out in his adult life. So piggybacking off of what you've mentioned about being purpose driven, and it's a full 360 journey in our conversation right now, because we started with defining what Heart Leader is all about. As a final question, Geoffrey, for someone who knows and acts upon and brings to life the concept of a heart leader, what does a meaningful life mean to that person and to you?
Yeah.
And how can you live that every single day?
Yeah, I think it absolutely certainly means that every single day, a heart leader is going to be, seeking to impact the lives of all the individuals they work with and serve with in a very positive, meaningful way. And then ultimately it's about meaningful, genuine connection and a desire to collaborate and move and advance forward together. Certainly, we are human, so we're going to still have mistakes along the way. We're going to have setbacks along the way. But when we're working, in that connection, we're going to experience it and learn and grow together as well. And I think also it's the type of experience where organizationally, when you have heart leaders together working together, you're going to see, just as I said earlier, higher performance, more results, but more importantly, a space where people will come out and say they have psychologically, health and safety, but also a space that allows them to be creative and imaginative, and that creativity and imagination will lead to innovation. And so ultimately, it will be the best possible culture, environment, and organization that one could ever serve.
Jeffrey, thank you so much for your very inspiring insights. I learned a lot, and I'm sure a lot of our listeners also did. For those folks who would want to reach out to you because they want to ask more and they want to find out more and to be mentored by you potentially, how can they best reach out to you or find you?
Yeah, they can definitely reach out on LinkedIn. Easy to find on there, just under Geoffrey M. Roche. Happy to connect, and certainly happy to talk further through this and be in this journey together.
Thank you so much, Jeffrey. Really appreciate this conversation and enjoy the rest of your day.
You too. Thank you very much for all that you're doing.